Okay, I'd walk in the room and provide the patient privacy. I'd wash my hands. Hi, I'm Alexandra. I'm going to be your student nurse today. Can I have you verify your name and your birth date? I would check the wristband to verify. I would do my 3 checks of the bed being in the lowest locked position, the call button being in reach, and they have some non-slip shoes on. And then I would explain the procedure. So we're changing the wound, cleaning the area, and assessing it for any signs of infection, and putting a new clean dressing change on. I would then check the order, see what the company policy is, and then I would assess the patient's pain level and any concerns they might have. Okay, I'm going to then wash my hands again. Apply some gloves. And then I'd begin to take the dressing off using the pinch-pull method to not irritate the skin. I would take the gauze out and I would assess the bandage for any signs of infection like drainage, the color, the amount, and if there's any odor. I would throw that away. And then I would assess the actual wound for signs of infection like redness, swelling, or pus. And if there's none of that, the wound is healing the correct way. I would then discard my gloves. I would clean my hands again, and I would start to get the supplies. I'm gonna put another pair of clean gloves on. I'm going to get my gauze. I'm going to use about 3 of them for this wound, but depending on the size, I would use less or more. I'm going to apply some saline to the gauze. Oh, there's none in there. I'm going to use a different saline. I'm going to take the gauze and I'm going to wrap it around my finger, the corners, and clean from dirty to clean and discard after each use. You don't want to introduce any new bacteria into the wound site. All right. And at this time, I would also measure the wound. I would have done that before I cleaned it. I forgot to state that, but I would measure the length and width, and I would use a Q-tip to measure the depth, but I didn't have that here to use. After cleaning it, I would apply the medication, but there's not any, but if there were, I would use the 3 checks and 11 rights. I'm going to get some new gloves on. Wash my hands. And I'm going to get some new gauze. Depending on how much drainage is expected, you would use more gauze. But now we're only going to use 3. To cover the entire length of the wound. I'm going to get my pad and place it on top, discarding any waste used in the process. Place that on top, get some tape, and use the window pane method. You don't want it to be too tight so it pinches the skin, but you still want it to stay. And then I would put my initials, the date, the time, and then I would document any findings I found and when I did the dressing change. And then I would also assess the patient on how they're feeling after getting this wound change.